keeping us separated, and you'll be able to find us because we are about to be in conversation with Dr. ROLENE, the Department of Health, and we want to find out what she did here today. Because the moment you hear Department of Health, I think a lot of people are probably thinking medication. Is she bringing us medication? What is she bringing us today? Without wasting any further time, over to you, John. How are you doing first things first?
Thank you very much for having me on the show. It's fantastic to be here. I'm doing well. Thank you. Thanks for inviting us onto the show.
You look gorgeous. I love the dress.
Thank you.
Right. What are you doing here today? And Summit is an stage. What is your role?
So I've been invited to share with the audience the digitalization and e-health that we're rolling out as part of the health turnaround strategy in our department.
Okay.
And we specifically were showcasing one of our projects called the HMS2 project.
Okay. Now, future plans that you have, projects that are actually going to happen in ICT.
All right, before we even get to the future, maybe I must just explain the context. Yeah, so our country has a strategy that, as we prepare for NHI, it's to develop an electronic patient record. It's really central to us being able to move towards NHI. But even within our department, we have a number of problems, and I think your listeners, the viewers, would be familiar with some of those challenges. And so we have conceptualized and we are implementing a health turnaround strategy for the province. That health turnaround strategy has a number of pillars and a foundation. One critical pillar of our turnaround strategy is digitalization and e-health. And so within that context, we've come to share with you our journey because we started it up, we kick-started the project on the 1st of September last year in rolling out HMS2. So HMS2 is a web-based electronic health system, and it was designed and developed at Freya Hospital back in when I was the CEO of Freya Hospital. Now as the HOD, I'm in a position to work with the team to roll it out. And in fact, it has now been adopted by the country as a standard for hospital management systems. We have now rolled out. Today we went live at our 18th site, and tomorrow we're going live at our 19th site. So we have now registered just over 4 million users. 4 million users on the platform at those facilities. We have recorded and processed over 500,000 patients through our outpatients departments. We've admitted and moved patients on our system, around 250,000 inpatients. So far, we've saved 21 million rand because we own, the system was designed and developed, we own the intellectual property. It's agile because we can adapt it and customize it to the needs in our system. Freya Hospital is the only one that has the full clinical modules, but we're rolling out in the first phase our patient administration modules, our medico-legal modules, as well as some of the other modules associated with administration. So we're very excited. We're aiming to do 28 facilities within the next 3 years. We've allocated 200 million rand into investing into our ICT infrastructure to make this possible. And what has really been heartwarming is when we go to a facility and our team goes live, when the facility starts utilizing the system, it makes everyone's life that much easier. So from the clerks who they don't have to go and walk, find a physical folder, draw the folder. With this capability, we are now able to capture the patient demographics on the patient, and it goes into the cloud. So we're creating a virtual platform with virtual facilities. And you can well imagine that if you're a patient and you come to one of our hospitals on the system, we capture your demographics once. The next time you go to any other facility, you're in the cloud. They can access your information. Precisely. And that decreases waiting time. Similarly, when the clinicians have clinical modules on, when we transfer the patient, you'll be able to transfer and access this record, this longitudinal record. We've now integrated with NHLS, our laboratory services, as well as our blood services. So results that come in from tests that are done are available to clinicians on NHLS. So it's really exciting.
Yes. It's the digital world. That's where we are. Because I actually love this point you're mentioning. You don't actually have to necessarily. Because you find sometimes you go to these health facilities, you go there, you need to put your details over and over again, but now they go to this, wherever you go, you'll be in the same hands. Before I let you go, I understand that you need to go. Any last words from your side, and then we can close it.
I think what we came to do here was to share some of the lessons that we've learned, because we are in an audience of innovators, entrepreneurs, and what we're saying is that we would like to partner with you. We can't do this on our own. The rate at which we can roll this out across the platform within our rural spaces in particular is dependent on resources. And if we could have more implementation teams, so we're looking at partnering so that we can have implementation teams to rapidly roll out under our guidance and support. We also are sharing it with other provinces. So the Free State has asked if they can develop a service level agreement with us because they'd like to roll out HMS2 in their province, and they're coming down in December to come and visualize and see it firsthand at Free Hospital, where we implement the entire suite. And in the new year, when we roll out to St. Elizabeth's Hospital out in the Siki, they'll be coming on, being part of the implementation team, so they can see what we do, how we do it, and how we take it forward. So it's really exciting. And the end note of what I said in my presentation was that had you been part of the discussion Anton and I had when I was the CEO at Freya, and people would have thought they must have sniffed some of the anesthetic gases upstairs, from the theatres. And had they been with us at the start of the journey last year, when we said we want to roll this out to 28 facilities, they must have thought, hold on, do you understand the challenges we have in this department? And here we are a year later. So if there's anyone who doesn't believe that this is possible in the Eastern Cape, we're saying come and join us, be part of this journey with us, because it's always impossible until it's done.
Until it's done. Oh my goodness, I love how you just ended that. Ladies and gentlemen, we were in conversation just now with Dr. ROLENE WAGNER, the head of the Department of Health. Then looking at time, it is exactly 36 minutes after 12 o'clock. Then so a bit shortly, man. We are definitely keeping it going. It is great to report to you when we are broadcasting live from ICC. This is the 16th annual Ict Summit, officially day 2, and it is going really, really well. It's exciting times. I definitely don't want to want tonight. But for now, please stay tuned and we will be back.
Thanks, Phoebe.
Thank you.
You're so good.
Oh,
well done.
Thank you so much.
You are brilliant.